Hello, this is Dr. Rozakis. I am an ophthalmologist, and I work with Brian Bakke, who's a PhD in biochemistry. And I'm excited to talk to you today about a new treatment that stops or reverses vision loss from macular degeneration by healing eye cells. This presentation is for people with macular degeneration, either dry or wet, or if you have geographic atrophy. It's also beneficial for diabetic retinopathy and other problems in the macula, as well as other age-related diseases. So let's dive in, because our goal is to eradicate age-related macular degeneration. This is now possible. The bad news is that this disease affects many people, almost 20 million. It diminishes quality of life. You can't enjoy your hobbies like golfing, you can't read, you can't drive as well as you'd like to, you don't feel safe driving. Your independence is threatened. The bad news is that this disease affects 20 million people. It diminishes quality of life, and it diminishes your ability to enjoy your hobbies, to read, to drive. It affects your independence. It's a progressive, frustrating disease. And if you plan on living a long time, the probability of getting the disease is higher and higher, and the probability of losing vision is higher and higher. So we need to do something about this condition. The current therapy for this disease is very simplistic. It's what I call one size fits all. It does not prevent dry macular degeneration. It does not prevent wet macular degeneration. It does not improve vision. It only helps maybe 1 in 17 people. It's a pretty ancient technology. It's almost akin to the rotary phone as compared to the iPhone. There's a need to do more for this condition. And it's a progressive disease. You can have it without any abnormalities visible in the macula, shown in this picture on the left, where everything looks okay, but it's not okay because there's a problem brewing in the biochemistry of the macula, which will lead to spots forming in the macula called drusen. And you can see these spots on special scans called the OCT scans. And these drusen are problematic because they can cause vision loss and also lead to wet macular degeneration where there is leakage of fluid and bleeding. And in that situation, eye injections become necessary. Another way that vision can be lost is due to something called geographic atrophy. That's where you see areas of destruction of the macula. And that's a problem. You can't see through these areas of destruction. There are eye injections now available to treat this disease, but they have side effects. I don't think they're necessary, but let's continue. So that's the bad news, and it's not good news. That's bad news. That's a problem, and that's why you're here. So let's now go over the good news. The good news is that Dr. Bakke and I, almost 10 years ago now, have been working together on a method to improve the health of cells, cellular health. My background is engineering. I went to Cornell Medical School. I trained in ophthalmology at the Duke Eye Center. I'm one of the pioneers of PRK and LASIK eye surgery. And I fell in love with this field of science called anti-aging medicine. But to do it well, you need a biochemist. You need a PhD in biochemistry. And that's where Dr. Bakke came in, who also brings to us a master's degree in nutrition. He did his master's thesis on macular degeneration, and again, we have about 12 years of clinical experience making cells healthy again. And this method to do this relies on blood testing, knowledge to produce this diagram, where we attack the problem of cellular disease by multiple strategies. Very important point. Multiple strategies. Many times, scientists and doctors try to treat something with one simple strategy, and it doesn't work. Well, it's because it's too simplistic a treatment. We attack the problem of degeneration by reducing oxidation, by reducing inflammation, by also taking care of something called methylation, which allows cells to turn back on their good genes and turn off their bad genes. I'll explain more about that later. We use nutrition. We like to turn off bad genes. And we also use certain hormones that people become deficient in, which further worsens the problem of cellular health. So what we figured out is that if you do all of these strategies simultaneously, you can optimize the biochemistry. Now there's a picture of a fist on this page. Why is there a picture of a fist? It's because when you make a fist, you pull together all of these strategies to give you more power to get a result. And that's what this represents. Hormones, oxidation, methylation, inflammation, nutrition, and genetics. All of those are brought together, and that gives the power that allows us to make cells healthy again. And you want to do that because cells are where it's all at. Dr. Oz said, and he said it right, making our cells healthier is the key to longevity and fighting disease. If you nurture your cells will nurture you back. And this benefits many conditions, not just the eye, bone health, brain health. So many different parts of the body benefit when you make the cells healthy again. We won an award for this work. It was the Advancements in Healthcare Award in 2015. And we're very proud of this award because we were the only group that won it back in Cleveland back in the day. So let me tell you more about this. So we started treating people for their general wellness concerns. That's where we started. And then something happened. We had this patient here who happens to be my mother, of all people, who had macular degeneration. So I put her on this strategy, this anti-aging strategy, and I noticed something. I noticed that her macular degeneration stopped progressing. If it wasn't for my mother, we probably wouldn't be here right now. The disease stopped progressing, not for just 1 year, but for 15 years, it stopped progressing. So that was a major clue. It's a major observation. We had to figure out why did that happen for her, and well, that's what this presentation is all about. And then we had a second patient who said she could see better in the dark, and that was exciting because that's not supposed to happen, and that caught our attention as well. That's the second observation. The third observation was monumental. It was a patient who could see better. So this was back in 2013, and we actually wrote this up because it was such a big deal. We were saying, hey, everybody, we need to go beyond those simple vitamins that people are using and improve vision in macular degeneration using hormones, genetics, and methylation, nutrition, and antioxidative therapy. And this was an amazing case. It's like, wow, this is crazy. This is not supposed to happen. So you can see how the excitement was building and building when we started to realize that we were getting a result in the macula, not just in the entire body, but in the macula. And then this patient came to our awareness. She had this lesion here, which was not getting better with eye injections. They were tried, they didn't work. And when we put her on our program to optimize her biochemistry, all of a sudden, look what happened. That lesion, that lump, that bump just disappeared and her vision improved, and she made the nightly news. And we were very excited about that. So this is important. This is exciting. It's like, wow, what did we stumble upon? What did we find? Is this real? And the answer is yes, it was, because we did a study in 365 eyes almost 5 years ago to see if it would benefit dry macular degeneration and wet macular degeneration. And the results were exciting. We found out that virtually everybody was stable, like my mother, but about half of the people, 48%, improved. They could see better. It's not supposed to happen. So that certainly got our attention. Furthermore, since it's been 5 years doing this, we're noticing that vision stays stable or gets better. So it's not as if they got better, then they get worse. They got better, stayed better, or slowly, continually improved. That's monumental. That's why we're here. That's why I give these presentations, because I got to get the word out before I retire and leave medical care. This is really important. We can stabilize and we can improve vision. That's a big deal. So the idea to take away from this is you have to treat your eyes before irreversible damage occurs. The longer you wait, the more degeneration will occur, the more cells will die, and the less likely we will be to get improvement. So if we want to get improvement, then treat before irreversible damage occurs. We can stabilize you where you're at in most cases, but if you want improvement, you need to treat before irreversible damage occurs. That's the smart move. So let me show you a few cases where we did this. Here's Marilyn. She came in at 2050. Then she went to 20/40, and now she's 20/30. So she had improvement of 2 lines of vision, and she's excited, and her overall health improved as well, which is wonderful. Here's a lady who had this really ugly looking lump here in her macula. Her name is Peggy. And Peggy had dramatic improvement. The lump is gone, and she is screaming from the rooftops, "My God, look, look, look." Her doctor is blown away by this. In fact, she said to us that we made his day by being able to convert this ugly lesion here affecting her vision to no lesion at all. That's exciting. Now, William is a great case also, but he's a bitter success. I'll tell you why he's a bitter success. William had 2400 vision, and we got him back to 20/80, and he could see TV better. That's nice. But I wish to God we had caught William when his vision was 20/50, before it dropped to 2400. And then we could have preserved much more vision, and he would be seeing today around 20/50, 20/60, 20/40, something better than 20/80. So the message here is, don't be like William. We can get you back some vision if you're in really bad shape, but don't get yourself to a position where you're in bad shape. Catch it as early as you can, and that's how you eradicate the disease. Now, for wet macular, for those of you getting eye injections, and I'm sure you hate your eye injections because they can be painful, and they can be dangerous, and they're stressful, as without a doubt. So for wet people, we saw the same thing. We saw improvement. They needed fewer eye injections, and I think their vision stayed better longer because of the program. And they had long-term improvement, which is interesting. Almost 2 years after being treated, we have people who are getting much better with regard to their wet disease. So wet patients can do well. I'll tell you why later on. There's a little secret as to why they got better, and I'll explain that in a moment. So let me give you some examples. Jennifer says, "Just want to let you know that I had very positive news from my retina doctor today. He literally said, well, this doesn't ever happen, but your vision and your scans are improved." Woohoo, so very happy. Wayne says his wet macular is gone. We see that. It happens. It's possible from my left eye, and I have an unexpected improvement in my dry macular degeneration. My eye doctor says this is the only case where the eyesight has improved in wet disease given the condition it was in. So how do we do this? What's the magic sauce? Well, I need to know about your medical history because I want to know what other diseases you're dealing with, because we can probably help those diseases. You have bone loss, high cholesterol, kidney problems, other things, fatigue, depression. What's going on in your life, because we can help with many things. As I told you earlier, we started out helping the overall body. But with regard to the eye, we want to know how your eyes are doing. And then we do blood work to identify deficiencies. And again, we do that through blood work. And based on that history and those deficiencies, we put together a care plan to provide supplementation that gives the cell what it needs. It might need some hormones stimulating it properly. It might need to be protected from oxidative stress. It might need to have a reduction in inflammation around the cell. Or it might have a problem turning on its good genes and turning off its bad genes. Or you're not eating properly and you're poisoning your cells as well, just based upon your nutrition. So to get this cell healthy, we need to put together a care plan to give it what it needs to be healthy. And this is true not just for the cells in the eye, but the whole body. And then another little bit of a secret is that part of the way this program works is an epigenetic effect, which I've kind of already let the secret out. Well, you can actually turn on good genes and turn off bad genes. And that's called epigenetics. So I ask you a question. Where does your biochemistry come from? It comes from your genes. Well, you know that. But a better answer is that it comes from your epigenetics, because your genes that are turned on produce your biochemistry. If a gene is turned off, it won't produce something in your body, which will put you in a state of deficiency, which will lead to degeneration. So that's the key to this. Part of the key is we turn on good genes so that the cell can defend itself, because the cell is smart. It's got a lot of power. It's been around for billions of years. It knows how to take care of itself. But if you turn off the good genes and turn on the bad genes, then bad things happen. So what's an example of that? An example of that is that you have genes in your cell which are designed to fight oxidative stress, which is a dangerous process in the body. If you have too much oxidative stress, it causes damage. But the genes that fight oxidative stress are turned off as we age. Also, as we age, our bad genes turn on, which are the genes regarding inflammation. Those genes, if they turn on, allow your body to attack your cells. And now you're killing your cells on your own, and that further leads to degeneration. And that's an age-related problem. That's why it's called age-related macular degeneration. As we age, changes occur in our genes, and the cell can't defend itself. Its hormonal support is gone. It can't turn on its good genes and turn off its bad genes, and it degenerates. And that's why you're losing vision. That's what we figured out. This was the magic discovery that we made, which propels us to talk about this. This is why we did the research that we did. So let's go back to wet macular degeneration. I told you there was a little secret I wanted you to know. There's a gene called VEGF. VEGF is a very, very important substance made by a gene, okay? And this VEGF is the cause of wet macular degeneration. Did you know that? It's the cause. VEGF stands for vascular endothelial growth factor. It's a growth factor. It stimulates blood vessels to grow, which leak and bleed and cause the need for eye injections. Eye injections remove VEGF. What we learned, fascinatingly enough, is that this method here can actually turn off the genes that make VEGF. That's a big statement. The method turns off the gene that makes VEGF. That's exciting, because if we can turn off the gene that makes VEGF, it will not accumulate, and it will lead to less cause of wet macular degeneration. That's an example of epigenetics. We want to turn off the gene that makes VEGF. Furthermore, even aging itself has a lot to do with epigenetics. A lot of scientists today think that the aging process is related to wrong genes being turned on and wrong genes being turned off. So I hope it's all coming together for you. If we can get to the cell and make it healthy again, we have a chance to stabilize your vision or improve it. And the sooner you do that, the better, because you want to treat before irreversible damage occurs. If you have a little fire in the basement of your house, you can just put it out and save the house. If you let it smolder and fester, it's going to burn the house down. Don't let this happen to you. Think of those little tiny spots in the back of your eye as little tiny fires. We need to put these fires out. So take care of yourself. Get treated if you can in the invisible phase of the condition where you can't even see it. There's a test called the ADAPT-DX test. And if you fail the ADAPT-DX test, that means your biochemistry is broken and you're on the road to macular degeneration. Some doctors have this machine called the ADAPT-DX, and then they discover people are going to develop the disease before they can even see it in the eye. So if you can treat at this point, you can eradicate the disease. That's why I use the word eradicate. You can eradicate the disease if you treat it in the invisible phase where you can't even see it. Now, if you have drusen, those little tiny spots we talked about, now you got a little bit of a problem brewing. In the beginning, they may not cause vision loss, but eventually they will. And if they cause vision loss, then you're not going to be happy about that. And we really want to treat people immediately who are developing drusen. But there's something else happening in this eye with dry macular degeneration, and that is that VEGF, that bad substance I told you about earlier, is accumulating. That's what this red line here means, this red arrow. So if there's VEGF accumulating in the macula, it's going to stimulate these blood vessels to grow and damage and leak and bleed inside the retina, inside the macula. So if you have dry macular degeneration, you want to take advantage of our program and take care of this problem if you have drusen. If you're smart and lucky, you can catch it before you've lost vision. If you've started to lose vision, hopefully we can get some of that back. You have a 50-50 chance of doing that. Hopefully you're not in this level of seriousness where you have geographic atrophy. These areas tend to enlarge. We believe our program can stop them from enlarging. And if you have geographic atrophy, you should really think about getting on our program. Otherwise, your retina doctor is going to be recommending eye injections, which have side effects. So if you want to avoid eye injections, take advantage of our method to stop the progression of geographic atrophy. Try not to get to this point. This is a very difficult situation here. This person can't drive, they can't read. It's not good. And finally, you certainly want to treat if you have wet macular. See, the artist is showing these new blood vessels growing. This is wet macular. Okay, so these blood vessels here are growing, and when that happens, you have to inject. But if you use the program as well on top of the injection, we can turn off the genes that are making the growth factors that are causing this process to occur. Okay? So, if you nurture your cells will nurture you back. That's what Dr. Ross said, and he's right. Give the cell what it's missing. If it needs hormonal stimulation, let's give it hormonal stimulation. If we need to reduce oxidative stress, we'll do that. If we need to take care of methylation to help the cell turn on its good genes and turn off its bad genes, let's do that. If you have inflammation in your body, let's treat it. And let's eat smart as well. Let's turn off bad genes. If we do all of these together, it's like that fist. And we can beat this disease and not let it ruin your quality of life, because that's where you're headed if this disease gets worse and takes off. So don't let this happen to you. Don't allow your macula to become destroyed. That's a lot of information. I hope you got it. You can play this back again and learn more from it. We have a program to help you. I'll tell you about it. It's called the Macular Program. Our goal is to eradicate the disease by catching it early. We want to stop vision loss, which we can do. We want to recover vision, which is possible for 48%. We want to help you avoid ever needing eye injections. Or if you're getting injections, we want to reduce the number of injections you're getting. And we want to improve your general health. This is the Macular Program. We need your history, your medical history. We want to know how you're doing, what else is going on, what medications are you taking, what dietary supplements are you taking, and we want to know what's going on with your eyes. So we like to see an eye exam and your history. We want to do laboratory testing, and based upon this information, we produce your care plan, your program. Along the way, we give you advice on how to eat. So if you eat smart, you can also help yourself enormously. And then we monitor you. We monitor you. We monitor your eye examinations. We monitor your labs at 3 months and 6 months. And we also want to be sure you're complying with the program. We expect you to be stable with this condition if you follow it carefully. After about 3 months or so, you should be stable. We expect improvement in about half of the patients in vision. We usually almost always get improvement in labs as well, and overall general health. And we expect to see a reduction in the need for eye injections. The cost of the program ranges depending upon your situation. If you're catching the disease very early, if you're very healthy, if you're seeing 20/20, maybe you've got a few little drusen here or there, but you're in pretty good shape. So we don't have to do as much to take care of you. So if we have to do less, we charge less. So it would be $1,000. If we have to do a lot, because your labs are very abnormal, because you've got lots of drusen, you're losing vision, and you have general health problems, then the price is greater and we spend more time working with you. We don't have to spend as much time if you are doing well or pretty well, but if you are in bad shape, we have to do more, so we charge more. The labs are typically covered by insurance, or we have a way to get them discounted, and the products that you may need based upon your history and your labs, it will cost you about $150 per month. And that's discounted because we provide discounts to patients. This is the general cost. Hopefully you can afford this. It's your vision. It's priceless. If you lose a lot of vision, it costs more money to buy low vision aids and other methods to help you see as best as possible. You just don't want to get there. Protect your sight. It's the best financial alternative possible. So the next step is we need to talk to you because we need to know about your situation. We need to provide you a free consultation. I want to hear about where your situation is with regard to your eyes. Are we just preventing things? Are things looking pretty good, like this picture here? Or do you have drusen? Do you have vision loss in drusen? Do you not have vision loss in drusen? Like what's going on? And do you have wet disease? What's going on with that? Or do you have geographic atrophy? So in addition to knowing about your general overall health, we want to know where you stand with regard to your level of eye problems. We have a link that I'll provide you down below. It's a very simple link. It takes you to a place on the internet where you can schedule your free consultation. It's so simple. You click the link, and you click a day, and you click a time, and you're good to go. Okay? Real simple. So who is a candidate for this? Well, obviously anybody with macular degeneration is a candidate. You have a progressive condition that you need to stop. We're the only group in the world who has been able to show that we can stop this condition. I mean, that's pretty exciting. If there's more technologies coming in the future, we'll be on top of them. But right now, we're it. The current therapies that you're on right now are one size fits all. They don't do any blood testing. I mean, it's really inadequate care. And that's why we created the macular program, because there's such a need. If you're going to have cataract surgery, you want to be on the macular program before your cataract surgery, because cataract surgery can worsen the macula. So if you have macular and cataract, take advantage of the macular program to make your cataract surgery safer. We spent a lot of time talking about macular degeneration, but if you're diabetic and have diabetic retinopathy, it works really well for diabetic retinopathy. So I highly encourage you to protect your macula with the macular program, because it helps diabetic retinopathy. And also general aging. If you're getting fatigued and slowing down and not feeling well, there's a good chance we can find out why and do something about it. So who is not a candidate for this? Well, if you have severe vision loss, if this is your vision where it's just a black spot and you can't see anything inside that black spot, that's unlikely. It's unlikely we can get anything back. If you're on chemotherapy for cancer, usually we wait until you're off of the chemotherapy. But if you've got some vision or reasonable vision, that's worth fighting for, then take advantage of us, because you have a progressive condition. It's progressive, it's progressive, it's progressive. Please get that into your minds. Now, this monitoring idea, why do we monitor? Well, we want to monitor your eye findings. If you have drusen, and are they getting better, are they getting worse? And we want to repeat lab testing. If you have abnormal labs, are they getting better, or are they getting worse? We like to monitor that to get the best results, so we can adjust your program. So that's why we monitor you. Now, these blood tests I keep talking about, do they improve? Yes, they improve. That's why it supports your general health. Kidney blood tests, liver blood tests, cholesterol, hemoglobin A1C for diabetes, C-reactive protein for inflammation, homocysteine, which measures methylation, and hormones such as DHEA can all be made better, and that can make your cells healthy. This is why the cells improve, because we're getting objective evidence of improvement in your blood work. You might want to know how quickly you might see better. The fastest we've seen is 1 week. One person got better and saw better in a week. It may take 3 to 6 months. It may take a year. The macula can sometimes heal slowly. Sometimes it can heal more quickly. Everybody's macula tends to be different. And by the way, everyone's macular degeneration can have different causes. The first person we treat might have a real problem with inflammation. The second person we treat might have a serious problem with methylation, or maybe they're severely hormonally deficient. So we learned it's not one disease. The degeneration can come from any one of those factors I talked about. That's why you have to treat all of them to get the results you're looking for. For those of you with geographic atrophy, we'll talk more about your situation on the phone, because it's not a complicated conversation, but it requires discussion. The goal is for you not to need eye injections for your geographic atrophy. The macular program can help with that, and we'll talk about that in greater detail. So schedule a call. I'll put the link into the chat somewhere, or into the or near this video. And also, if you can't figure out how to click the link, or you're having a hard time connecting with us, call us at 440-777-2667. And Dr. Baki and I will get to work looking at your history, looking at your labs, making your care plan, and trying to preserve the cells in your macula and preserve the cells in your body so you can improve your quality of life. That's the whole point of this presentation. So take advantage of it. Take advantage of it and have a great day. Thank you.